Hello, I'm Jim Demo with Clark County Close-Up. Thank you so much for meeting with us about this issue.
I'm delighted to be here, and thanks for giving us the opportunity to talk about this, because we've been getting lots of questions, so this will really help.
Sure. So what is COVID-19, and is it the same as coronavirus that we're hearing on the news?
Yeah, so COVID-19 is the new coronavirus we're hearing about. So coronavirus is a whole family of viruses, and they typically cause common cold symptoms. So there are coronaviruses out there all the time. Occasionally you get the development of a new variant of this. We saw that a number of years ago with SARS, when we had the SARS outbreak, and then that was, and I think it was a while ago. Mm-hmm. And then we had MERS, Middle Eastern Respiratory Syndrome, several years ago. Those were new coronaviruses at the time, and they tended to be pretty severe. So what we're seeing now is what we're calling COVID-19. Seems like it developed in China, and it looks like the original cases, the first cases, were based on exposure at a live animal market, and it looks like this is a variant of coronavirus that jumped from animals to humans. The problem now is at first it looked like it was transmitted from animals to humans at this live market, but now we've got evidence and information that it can be transmitted person to person, so humans can transmit it from one to another.
Okay. As of late February, the main areas were in China and cruise ships, and now in Italy.
So the only travel advisory right now, and I'm going to try to put this in perspective because I looked at the numbers last night, there have been about 81,000 cases in the world, and 78,000 of those, and when I looked last night, were in China, were in mainland China. So I want to put that in perspective. By the way, Johns Hopkins has a really nice website where it's an interactive map where you can actually look at the latest numbers from around the world. There have been a number of cases now. You know about the cruise ship, one of the cruise ships. The other ship turned out, I think it's called the Westerdam. Okay. Somebody had a positive test there, but when it wasn't verified, the test, so there was no, that ship that originally thought to be a problem isn't. It's the Diamond Princess where there are a number of cases. And I believe there are more cases on the Diamond Princess than there are in the United States right now. So I want to put that in perspective also. But the main risk in terms of where the travel advisories are is mainland China. There have been a number of cases in, over 1,000 cases in South Korea. There have been cases in Japan. There have been cases in Italy as well. But the vast majority of cases are in mainland China.
Now, any idea if this virus is considered more dangerous than our common influenza?
Yeah, that's a really good question. So unfortunately, there's not a lot. We're gathering knowledge all the time. There's not enough knowledge about this yet, but we're working on it. Right now, and so just to give you an example, we don't know how many people without symptoms there are that are infected. We only know about the ones who get sick and get tested and have the positive test. Right now, it looks like, from what we know from the outbreak so far, it looks like the mortality rate or the death rate is less than 2%. We don't know how much less than 2% it is, and we're only seeing it in certain parts of the world. The mortality rate from influenza is about 0.1%, so significantly less than that. That being said, influenza is a lot more common, and we have tens of thousands of deaths every year in the United States from influenza. And if I had to say, what people are at risk for in Clark County or in Washington, the United States right now, it's more influenza because there's a lot more of it around, and because of it's so frequent, that's something that people really do need to be concerned about. Right now, in the state of Washington, we've had one case of COVID-19, the novel coronavirus, and that person has recovered. So in terms of risk, I'd be a lot more concerned about the flu, and this is an opportunity for me to plug the flu shot, because we're still in flu season and it takes a couple of weeks to build up immunity after you get the flu shot. So I'd strongly recommend that people do that.
Now speaking of flu season, is COVID-19, do they anticipate that in the summer the transmission will go down?
I don't know the answer to that. I mean, we could speculate that, the other kinds of coronavirus, common cold, those things tend to be more common in the winter. I can't really speculate on something like on that. There's another thing I want to put into context on this because people are concerned about it. First of all, we don't have very little of it in the United States. I think there's been about 17 cases in the United States so far. It's not nearly as contagious as something like measles. So I want to put this into context also so people understand. With measles, we call the transmissibility, we have a term called reproductive index. And measles has a reproductive index of about 12 to 18, which means if you have a person with measles and you have people around them that are not vaccinated, not immunized, 12 to 18 of them are going to get sick. That's how contagious it is. With COVID-19, so far it looks like the reproductive index is around 2 to 3. So 2 to 3 people will get sick. And you need to have fairly close contact with somebody. You know, with measles, you could go into a room 2 hours after somebody with measles left it and you were susceptible, you could get the disease. With COVID-19, you need to have closer contact. It's spread by the respiratory route, and you can get it when somebody coughs and sneezes on you, and you can also get it if they sneeze on something and you touch it and then you touch your nose, your mouth, you can get it that way. So, but it's not nearly as contagious as something like measles is. I want to put that into context as well.
Okay. So as of, we're taping this on February 26th, have there been any reported cases in Clark County?
Zero.
Zero cases in Clark County.
And as of today, February 26th, there's only been one case in the state of Washington. And right now there's a number of people who are travelers from mainland China who are being monitored. Mm-hmm. There's only one person right now under investigation. And what we mean by, we call them PUIs, persons under investigation. That would be somebody who came from mainland China, who's now got symptoms and is being tested, and we're waiting for lab results. Right now, as of February 26th, in the state of Washington, there's one person under investigation. We've had one person in the state of Washington who traveled from China, had coronavirus and has recovered, and we've had 26 folks who were being investigated have had negative results. So I want to put those numbers out there as well.
Okay. So the risk factor for someone getting it in Clark County at this point is very low.
Yeah, extremely low. I mean, I want to put, yes, very, very remote.
But you did say, obviously this is a quickly changing narrative. We talked about ways you can minimize your risk. Let's talk about some of those. Even though the chances of it happening, this is good overall safety for any influenza, any virus.
Right. So the other point about this, this is good stuff for any respiratory illness that's circulating around at this time of year. So one of the things we want people to do is stay home if they're sick. That'll protect everybody else. Cover your cough, and both in protecting other people as well as protecting yourself, wash your hands frequently, and certainly try to avoid touching your nose or mouth. But wash your hands first if you do need to touch your nose or mouth. Avoid doing that. We are not recommending, and I want to repeat this, not recommending that people wear masks.
Okay.
People who are well should not be wearing masks. We're not recommending that. It doesn't really protect you from, it may reduce your likelihood of touching your nose and mouth, but wearing a mask all day is kind of difficult. It really is not great protection if you're well. If you're sick, you should stay home, but certainly if you're going to be seen at a healthcare provider's office, they're going to mask you up if you're sick to protect you from infecting other people. But we're not recommending that people wear masks at this time. And the other point I want to make is that there is a shortage of protective equipment because, like masks, or there will be. We're concerned there could be one down the road because a lot of these items are manufactured in China where they're not manufacturing as much. So, but the bottom line is, if you're healthy, wearing a mask is not really going to protect you much. We're not recommending that.
Okay. The fear of this virus is obviously growing. It's in the news constantly. Stock markets dipping, and it gets to a point of hysteria. So should should you avoid people? Is there any reason to avoid people based off their nationality or their ethnicity?
Yeah, that's a really great question. So, just like measles, none of these viruses, bacteria, they do not discriminate against people. They do not attack people based on their race, their ethnicity, their gender, anything like that. There is absolutely no reason to avoid somebody because of their, their appearance or their. Certainly, if somebody is coughing and hacking, no matter who they are, hopefully they'll stay home. But
Right.
I would avoid that. But there's no. I mean, I really don't want people making assumptions based on somebody's ethnicity, race, or anything like that about whether they're at risk for coronavirus, because that is not true at all. And there have been cases where people get discriminated against because of that, because of the fear. But there is no association between ethnicity, race, gender, or anything like that, and risk for COVID-19 or any other biologic event.
So how is Clark County preparing for a possible outbreak?
Yeah. So one of the things we're doing is we're working really closely with this. We're in constant contact with the state of Washington. Right now there are people who have traveled who are under supervision. They're not sick, but we get information from the state, and people who are traveling from mainland China are told to watch for symptoms and to contact us if they do develop them. There are about 15 people right now in Clark County who don't have symptoms, who have been, as of February 26th, I should say, who are, had traveled from mainland China within that 14-day period. So they've been asked to check for symptoms and to call us, and if they do, we will arrange for testing. And we're working really closely with healthcare providers on that. We've gotten advisories out to healthcare providers about getting, collecting specimens. We'll be meeting with our healthcare partners this week to talk about how we coordinate together, even around things like patient transport and stuff like that. So we've been doing a lot of work with our healthcare partners. We've already been talking to the schools, because if we do have cases in schools, we're concerned about making sure that we in the schools have the resources to work together and have the communication intact. So I don't think this is a good thing, but the experience with measles, I really helped.
Just last year.
I mean, that's not the way to.
Yeah.
That's not the way to get better at doing this
Right.
stuff, but the experience with measles and the relationships we developed working on that really are pretty helpful as well.
Now, again, as of the 26th of February, very low risk of it coming to Clark County. But what would be some things that are potentially, if let's say there was an outbreak, again, very low risk, but if there was, what are some things that would possibly happen?
So we're going to respond to this in a similar way that we responded to measles. So one of the most important things is to be able to detect a case. So if we have somebody who's been exposed, and the people we're most concerned about are people who are traveling from mainland China, especially from Hubei province, although that's changing now, but it's mainland China, or somebody who's been exposed to a laboratory confirmed case.
Okay.
So if somebody's traveling from mainland China develops symptoms, or somebody who's being monitored, and hopefully those folks are under the quarantine, so they're staying home and they're not exposing other people. But if we find out about a case and and their lab confirmed, we will be, just like we did for measles, we will be interviewing them and asking them, where they've been for the past 14 days to look at potential exposure sites. And then during the time that they've been symptomatic, and by the way, I'm going to digress here for a second. One of the things we're learning about COVID-19, novel coronavirus, is when in the course of the infection they're contagious. We're pretty sure they're contagious when they have symptoms, but we don't know enough about people who are infected who still don't have symptoms and how contagious they are. Right. So, but we will be interviewing people when we get a case. We will be interviewing folks to find out where they might have been, when they were contagious, and then who they were with and who they had close contact with. Then, when we determine who they had close contact with, we will be monitoring those people for 14 days because now they've been exposed to an active case. So we'll be asking them to stay home. We will be doing home quarantine with them, similar to what we did with the measles.
Okay.
If the number of cases increases significantly, and we're hoping that this will help protect folks, we will be looking at other methods of social distancing working with our partners. And I'll just give you some examples. Whether events, congregate events like fairs or concerts or sports events, if we had significant amount of the disease in the community, we may be asking those folks to cancel their events. If we have cases in a school, we may be looking at, depending on where the case is, this is not as contagious as measles, but depending on where the case is, we might be looking at some school exclusions or closures. We're not anywhere near that, and I'm not even sure we would get to that point. It really depends, but those are the kinds of things that we've been thinking about.
And at this point, there's no shot, no immunization that can deal with this.
I'm really glad you brought that point up. One of the things, the efforts so far around the world, including the efforts that are made in China, are really helping to buy time. The more of these other things we can do to prevent spread, or at least it's kind of like having a race against this virus, and if we can hold it off for long enough, the development of vaccine would be really very promising. So that's another, besides keeping people from getting sick, just delaying the spread or doing whatever we can to keep it from spreading and using those social distancing measures, hopefully will buy us enough time for vaccine development.
Okay, so the big thing, it sounds like, keeping in communication with people. So, and at points, social media, there's all kinds of rumors and hysteria can happen. So where should people turn at this point to get credible information?
Yeah, that's a really great question. And I know there's already a lot of nonsense going on in social media around this. The State Department of Health, and we can maybe put up the URL, the address. But if you just go to DOH for Department of Health.wa.gov, and if you go to their main website, it'll pop up right in front of you, a coronavirus. Also, the CDC has some great information. So that is cdc.gov, and if you click on that, it'll pop up right away. And actually, you go to the CDC site and you can see what travel advisories there are. And right now, there's just a travel advisory telling people not to travel to mainland China unless some sort of emergency situation. But so those are really good sites. We're putting stuff up on our website.
I noticed that, yes.
And so Clark County Public Health, we could provide that. And we're looking at, we use social media, so we use Facebook and Twitter. So we'll be putting information out there as well. People can also talk to their physicians and get right in. So there's a lot of good places to get accurate information. I would not rely on unverified social media sites for information because there's a lot of misinformation going on already.
And I noticed that you also noted the Washington State Department of Health phone number for dealing with this issue, 1-800-525-0127.
Thank you. I didn't have that memorized, but you have that in front of you, so
sure.
Thank you.
Well, thank you so much for meeting with us.
Right, I hope this is helpful. And once again, I got to put this plug in at the last minute. Get your flu shot if you haven't gotten it already. Stay home if you're sick. Wash your hands. Avoid touching your nose and your face, and be healthy.